Hello, and thank you for joining us. I'm Sandy Potter, along with Masonicare President and CEO, JP Venoit, Dr. Ronald Schwartz, our Senior Director for Continuum Health Services, and we're so happy to have a special guest with us this week, Annie Hoefferle. She is the Executive Director at Masonicare at Chester Village. Welcome, Annie, and thanks for joining us.
Thank you so much for having me. This is an honor.
We're so happy to have you. You know, we asked you to come on because this past year has been like no other, and your leadership there in Chester has been just incredible. Can you give us your reflections on everything your staff and your residents have gone through during this pandemic?
Yeah, absolutely. So I think with the pandemic, I think there was a lot of fear in the beginning. We didn't really know anything about how it was transmitted or how to protect staff, how to protect residents. All we knew was stay 6 feet away. They weren't even recommending masks at the beginning. And I think when we started our coronavirus task force with the senior management of Masonicare, we were able to have all of these experts in a room and kind of come up with our best course of action. And one of our main goal was always to protect and preserve life, right? I mean, that was the goal of the pandemic. And with getting the information and educating staff and being proactive about mask wearing, I think we started wearing masks in our community the last week of March, which was really, really early on, and washing our hands. I remember I put a 2-minute looping video on hand washing on our in-house channel for residents, and they said that every time they turned on the channel and they saw the video, they knew that they had to come back 2 minutes later. And I said, you were supposed to watch it, because I don't know how people were washing their hands before, but it wasn't a 30-second scrub in for surgery, and that's just that change was a big change. But the staff here and the residents here, they listened, they followed, protocols, procedures, and we were really lucky, throughout the pandemic, we ended up with a less than I think it was 0.09% positivity rate. I mean, the really, really low compared to the national averages, especially for congregate living and senior living. Just really, really brave staff. And I think the information as it came out, we would pull back everything, and then we'd slowly say, okay, this is safe, and this is safe, and this is safe, but don't do this, and this, and staff took it so seriously, and they kept themselves safe at home and safe at work, and residents, they listened, and we weathered the storm. But I think now, kind of on the opposite side, so we have 100% resident vaccination here at Chester Village, and so we're kind of in a little bubble, and we're able to start resuming normal activities again with masks, of course, but residents are dining every evening together in the dining room. We have our coffee set up in the morning so that they can have a cup of coffee and read their newspapers together, and we're serving lunch and dinner in our bistro, and we're starting to do some in-person activities. We have, I think we're allowing groups up to 10 in our exercise programs. So they're really spread out, but, life is starting to return to normal. And as long as we're operating inside our bubble. So, I keep telling my staff that this is a marathon. This is not a sprint. And, I think we got to September and I said, this is mile 18. We still got miles to go. And now after being vaccinated, I think we have over 90% staff vaccinations as well. And I keep saying to everyone, now that we're vaccinated, I said, the marathon is not over. I said, we're at mile 26. We still have that last 0.2 to go. And We still have to be really vigilant in our lives here at Chester Village, as well as our lives at home. So, you know, when you get that vaccination, it feels so exciting because you think, you know, I can do anything I want, and you know, we still have to take super precautions to make sure that we're protecting ourselves, our families, and our residents. And so, you know, I think the endurance of surviving this pandemic has just been incredible, and I have the most amazing staff here at Chester Village. So, really, it's been quite the experience, but we've really weathered the storm, and we're on our way out.
Yeah, absolutely have such a perfect example of teamwork there in Chester. And JP, I know you have been so touched by how all of our residents and our employee team members have responded every step of the way.
Sandy, first I want to thank Annie and all of her staff for everything that they've done at Chester Village, because, you know, we're actually at day 388 from the start of our task force, day 367 since our first 2 cases, one at Asher Village and one in the community. And it's been extremely stressful. It's been a challenging time, but Annie's team has done a truly amazing job at fighting this. And I will say there were times where, you know, the decisions that had to be made weren't the popular ones. Annie had some times where some of the residents were in her office saying, hey, we don't like this. We don't want this restriction. We want more freedom, or whatever it might be. And she's been able to manage that tidal wave very well. So Annie, thank you to you, your leadership there, and all your staff for everything that they've done. As Annie said, this isn't over. We are still battling to some normalcy, but you know, just yesterday we saw an uptick in the number of cases from the previous day. So we need to continue to be vigilant. Wearing a mask, 6 feet of distance, large crowds are all still things that we need to continue to really stay abreast of. And Annie talked about it. You know, Annie, I think it was maybe 2 weeks ago when I visited there, and I've said this, the energy level that you're seeing now has elevated quite a bit. You know, that the residents walking around, having dialogue, sitting in the little cafeteria area, or seeing them in the library. They're wearing their masks. They're 6 feet away, but that energy of having that dialogue is truly something that gets me excited, because that gets us closer to that normalcy. And when we think about this past year, absolutely, it was extremely stressful, but there were so many great things that have happened. Seeing some of the pictures of the virtual happy hour at Chester Village, or the delivery of meals. You know, if you think about it, I think I said this last week, but we're over 1 million meals delivered to all of our residents since the start of this. I think we've now had 65 vaccination clinics. So when Annie talks about her residents being 100% vaccinated, that's due because we did all those clinics, and we were able to do it quite a bit. And I will say this, our residents have put their trust in us, and leaders like Annie have really been able to have our residents feel that they can trust what Annie and the staff are saying. And though she got a little pushback on some things, they all respected and understood that she was doing it for the best interests of those residents. And that's not easy. It's a hard task to do, but we've been able to overcome quite a bit of adversity over this past year. And I think as we move forward, we are going to get to some normalcy. The vaccine is coming out. There was just a report from Pfizer today that I think it's between 12 and 15 the vaccine has 100% effectiveness. So we're seeing some very good positive movement. However, and this is still what we need to continue to say, we need to be vigilant. Just because you're vaccinated does not mean you can't get it or give it to somebody else per se. So the mask, distancing, large groups still has to happen. And we're going to continue to work on that as we also talk about our opening plan at each of our communities. But last, I just have to say this again, Annie, great job. Your staff have done an amazing job. And the residents, just seeing them, I can't see the smile, but I could tell there's a smile behind that mask when I go there. So great job. Continue to help us get to that normalcy. And we are Masonicare strong. We will be able to get through this.
Thank you.
Thank you so much, JP. Absolutely. And Dr. Schwartz, this week, vaccine eligibility opens up to everyone over the age of 16. And I know you really would like to again stress how important it is for everyone to get vaccinated as soon as they can.
Exactly, Sandy. First, what I would just want to say is, in my new role, sort of being medical director through the Continuum, I as well want to thank Annie. It was great to work with you. I didn't even know where Chester was, and it's like so beautiful there. Sometimes on a Sunday, we used to in the summer when we didn't have any specific thing to do, we just go to a park there or walk around. It's beautiful. The facility's beautiful. So that's one of the nice things that I get to do. Sandy, you make a really good point that, now we're moving to 16-year-old people, being able to be immunized and so forth. And I think the real take-home message is the quicker and the more people we can get immunized, the better. And one of the main reasons for this is what we were talking about before, variants. And there are more and more variants that are coming out. And really the only way to stay ahead of the variants is to get immunized so that the virus doesn't have a chance to mutate. And we had talked before that, this COVID-19 virus is an RNA virus. And what does that mean? Well, it's similar to the flu. Every year the flu mutates. That's what a virus does, particularly an RNA virus. And where this mutation seems to be targeted is the spike protein. So it's really important to be diligent and to continue to get vaccinated. And I think the other point is that these newer variants are more transmissible, and some of them are more potent. So we really do have to be aware of this and careful about this. I got some data just from the CDC, just for interest. This was from Monday. It kind of talks about the main variants we've been seeing from the UK, South Africa, and Brazil, and the reported cases in the United States. So the UK variant is actually called B117. And there's been 10,579 cases in the United States. So, this is significant. The South African variant, B1351, was 288 cases. This is like Monday's data. And the Brazilian variant, which we talked about recently, was P1, was 118 cases. So you see, like we said, as much as I want to, and I am optimistic, we're not fully out of the woods yet, and this is the reason why. There's a term I used before. It's called herd immunity. And what herd immunity is if enough people in a population get immunized, and usually it's like 80-90% of a population, then an individual isn't able really to transmit the virus or to get infected by the virus. But we're not, and then the virus eventually has no place to go and can't survive, and it starts to fizzle out. But again, we're not at that point nearly yet. And beyond that, with mutations, I don't know if we'll ever, fully be at that point. So as JP stressed, and I stress in each one of these meetings, it's important to continue to be vigilant, wear masks, hand wash, social distance, avoid large crowds, avoiding travel, and most importantly, to get vaccinated for all these reasons. So Annie, this is your first meeting with us, but usually once a week I come up with an inspirational quote that kind of gets me through the week, and hopefully other people too. So the quote for this week that I have is, "Your journey begins when you feel you've reached your limits." So we're kind of all feeling like we reached our limits. It's been more than a year, and it just keeps seeming like it goes on and on. But I think we're definitely making progress. You can see it all around us. And I think a new journey is about to begin, where we're going to have a better quality of life and more freedom. And you know, in the meantime, we just have to continue to be diligent. So once again, I thank everybody for their hard work and dedication, and once again wish you health and peace. Thank you.
Thank you, Dr. Schwartz. As usual, the perfect words to send us all on our way today. Well, thank you all so much for sharing your time and your insights with us, as always. And we thank you for watching at home. Until we see you next time, we hope you'll stay safe and stay well.